Morning, Suzanne. We are going to do a screening today. We use the Community Resource Network's screening to complete the Accountable Health Community model, which is being offered to help connect you to services in your area that improve your well-being. The needs identified are defined as the social determinants of health. An easy way to explain this is by finding areas you may not have resources in and providing services to help you become more comfortable and successful as a person. Services are affordable, with many being offered free of charge. By having you answer these questions, we may be able to provide you with the resources that are to your advantage. Please answer the questions in your own words, as there are no right or wrong answers. At the end of the survey, we will discuss the resources available to you. Let's get started. First name, last name, birthday, and gender values will be pulled from the HRSN client registry automatically. Suzanne, what language are you taking the screener in? English, Spanish, or other?
In English.
Complete the following statement. I am answering this survey about myself, my child, or other.
Myself.
Okay, what type of health coverage do you have?
I'm currently uninsured.
How many times have you received care in the emergency room or ER over the last 12 months? 0 times, 1 time, or 2 or more times?
2 or more times.
Okay. What is your living situation today? I have a steady place to live. I have a place to live today, but I'm worried about losing it in the future. Or I do not have a steady place to live, and I am living with others in a hotel, in a shelter, or outside on the street.
I have a place now, but I'm not sure how long we're going to be able to afford to stay here.
Okay. Think about the place you live. Do you have problems with any of the following? Pests such as bugs, ants, or mice, mold, lead paint or pipes, lack of heat, oven or stove not working, smoke detectors missing or not working, water leaks, or none of the above.
So currently I don't have heat because I haven't been able to pay my utility bill.
Okay. Within the past 12 months, have you worried that your food would run out before you get money to buy more? Often true, sometimes true, or never true.
Sometimes true.
Within the past 12 months, the food you bought just didn't last and you didn't have money to get more. Often true, sometimes true, or never true.
Sometimes true.
Okay. Transportation. In the past 12 months, has the lack of reliable transportation kept you from medical appointments, meetings, work, or from getting to things you need for daily living? Yes or no?
Yes.
And you said that they had shut off your heat already. Is that correct?
Yes, that is correct.
Okay. Safety. How often does anyone, including family and friends, physically hurt you? Never, rarely, sometimes, fairly often, or frequently?
Rarely.
Rarely. How often does anyone, including family and friends, insult or talk down to you? Never, rarely, sometimes, fairly often, or frequently?
Sometimes.
Sometimes. How often does anyone, including family and friends, threaten you with harm? Never, rarely, sometimes, fairly often, or frequently?
Rarely.
Rarely. How often does anyone, including family and friends, scream or curse at you? Never, rarely, sometimes, fairly often, or frequently?
Rarely.
Rarely. Family and community support. How often do you feel lonely or isolated from those around you? Never, rarely, sometimes, fairly often, or frequently?
Sometimes.
Sometimes. How many people do you live with in your household?
Currently there are 5 here.
5. And how many are children under the age of 18?
2.
Oh, do you know what your annual income is from all sources in your household?
It's probably the 20 to 25,000 a year.
Okay. Okay. Thank you very much for answering these questions. As we look over the answers to identify areas of need, are there any specific resources you feel would be helpful at this time?
Some way to get my utilities turned back on.
Utilities?
Yeah.
We can set up a meeting with you, Suzanne, to work with a navigation person if you would like, that can go over this and kind of follow you through the steps and assist you. Would you like that?
Yes, I would.
Okay. I will put their phone number here in this form, and then I will go ahead and give you a card with that information on it. Would you like to schedule that meeting today?
Yes, I would.
Okay, let me grab my calendar and we will get that scheduled. Again, thank you for taking this survey. Do you have any additional questions?
I do not.
All right, great. Thank you.